you have to have a completely different operating system of healthcare to reverse chronic illness. Well, like, first of all, chronic illness is reversible. And, there are incredible examples of chronic disease being reversed, not just, cardiometabolic issues, which I think are the most obvious examples or the most plentiful examples of chronic disease reversal, type 2 diabetes reversal, cardiometabolic disease reversal, but, Alzheimer's and digestive disorders and autoimmune diseases, are also reversible.
Today, we talk with James Maskell, who is a health economist working to improve healthcare systems around the world. James's approach uses community and group medicine to reverse chronic conditions ranging from heart disease, diabetes, mental health, autoimmune diseases, and even just to promote health more generally. After spending the last 20 years learning about medical systems and healthcare, he wrote 2 books, The Evolution of Medicine and The Community Care, and James is just an incredible wealth of knowledge. I hope you enjoy this discussion as much as I did, where we talk about the role of community, the impact of loneliness, how to reverse different chronic diseases, and the future of medicine. Well, thanks so much, James, for coming on today to talk to our audience. Just to start out, we're huge fans of you and your work, and so I'm really excited and grateful to have you on today.
Yeah, great to be here with you. Thanks for having me.
So I thought we could just dive right in and kick it off by sharing your background. I know you went from kind of an intentional community in Colorado to investment banking, health economics. Take us through that whole journey. How did you come to do what you're doing today?
Yeah, so I was born in a commune in Colorado. That commune, amongst other things, was sort of very involved in like the early stages of professional natural medicine, I would say. So natural medicine delivered through health professionals. And, because of that, my healthcare that I received in my early years, the first 13 years, was what you would call abnormal or alternative. So I had a chiropractor and I had a homeopath, and, we used to go every year to this farm in Colorado, and, I worked on the farm, and it was like, it's an organic valley, which means that there's never been a pesticide in the valley at all. And so, that was how I grew up, and I didn't realize that was abnormal until I went to boarding school when I was 13 in England and realized no one knew what any of those things were. And that ultimately having a homeopath and a chiropractor was very abnormal. And, that was sort of like, a foundational lesson. I got interested in economics, and I studied economics and then health economics at university. And it was at that point that I realized, like, both in the UK and in the US and in Mexico, we are now facing an economic catastrophe on the back of chronic illness. And the cost of treating chronic illness and the cost of delivering chronic illness was going to bankrupt every single country given enough time. And, I had at that point, I finished my university, I had a job as an investment banker. And within a year, I quit that job to go and follow this path. I didn't really know where it would lead, but I knew that I wanted to do something that was meaningful. And I just had an inkling that something about the way that I was brought up was the solution to the problem. And I wanted to go and investigate it. And that was 17 years ago. So, I've been on the path ever since.
And so talking about Heal Community and your work there, tell us about kind of the origin story. How did you know this would work?
Yeah, so Heal Community is my latest project, and it's, I think, hopefully the thing that can solve the problem that I set out to solve 17 years ago. But in the meantime, there's been a lot of learning. And so the first thing, I had to learn was that you have to have a completely different operating system of healthcare to reverse chronic illness. Well, like, first of all, chronic illness is reversible. And, there are incredible examples of chronic disease being reversed, not just, cardiometabolic issues, which I think are the most obvious examples or the most plentiful examples of chronic disease reversal, type 2 diabetes reversal, cardiometabolic disease reversal. But, Alzheimer's and digestive disorders and autoimmune diseases, are also reversible. It's just a little bit more complex. And ultimately, I spent 10 years really understanding that by serving doctors and clinics that were practicing this new standard of care, which is, I would say, I'm going to make an effort in the next decade to popularize the idea of health medicine. So medicine built around health that may be called functional medicine, integrated medicine, lifestyle medicine, whole health. These are all names that have popped up that have a lot more similarities than they have differences. And what they're all focused on is sort of a lifestyle focus, root cause approach. And ultimately, so I spent a lot of time understanding that. But what I also came to understand is that medicine is nowhere near efficient enough and has real, the first generation of that care is so resource inefficient, right? You're talking about really long appointments with really expensive providers that there's not that many of. That equation can't solve the problem. And actually, you can't scale to solve the problem with that use of resources. And so the last 4 years, I've been thinking about, well, how could you do it? And so that led first to my second book that I wrote called The Community Cure. And in that book, I showcased models that were efficient enough to become a standard of care, delivering medicine in groups. And I showcased all the effective ways in which groups, when you take a group delivery system and you sort of power it with that whole health approach, with that functional medicine approach, with that lifestyle approach, you now have something that could become a standard of care. And then I brought that book out in January 2020. It was like, okay, in this next decade, we're going to sort of do what we're talking about in the book. And then COVID hit and all group medicine was shut down everywhere around. And that started the process of building Heal Community. And now Heal Community is essentially a technology and service company that takes all of the pain out of executing these groups. And so we offer this service as a service to industry. So to health systems, to payers, to hospitals, to clinics, and hopefully eventually to sovereign nations as a sort of a population health delivery system for this whole health approach.
And I'd like to, just for those who have never heard or listening to us and never heard of group medicine, how does it work?
So in our model, you take a cohort of people. Typically, they have similar symptoms, or actually in some cases, they don't have similar symptoms. They can have different diseases in a primary care level. But you take a cohort of people that are either made up of people with varying conditions or the same condition. And essentially, in our model, we spend a month helping them to get familiar with each other, to build trust in the collective. They're supported by coaches. They're matched into pairs. We spend the first month in really building trust in the collective. And then over the next 5 months, it's about working together to build new healthy behaviors and to be accountable to each other, to support each other in that journey. So it's a reimagination of medicine with a cohort of friendly community members as the sort of core structure. And then, obviously you can add in whatever other services on top of that. But what I see emerging is a new way of doing medicine where the center of your medical care is this group that you're part of, this cohort that you will be connected to ideally forever. And that, once you have that strong central core, you don't need as much of what we have come to see of medicine. You don't need as many dietitians. You don't need as much primary care. You don't need as much specialty care. You don't need as much medication. You don't need as much cost. And ultimately, if we come back to where we started, the goal of my work has always been to create a structure that could sort of flatten the curve of healthcare costs, arrest this exponentially upward trajectory of healthcare costs. And so that's what Heal Community is.
Awesome. And, for thousands of years of being working in tribes, living in tribes, kind of in more community. So it seems like this would work. What models did you look at in a clinical setting? Like I know there's Cleveland Clinic, I know the Mayo Clinic has some type of group medicine.
Yeah, well, first of all, just as a reason for it, like loneliness is the biggest driver towards mortality, right? So, functional medicine, which is sort of the world that I grew up in, likes to think of itself as the root cause medicine. And ultimately, if the biggest root cause is loneliness that drives, lonely people have significantly worse outcomes in those major costly chronic illnesses, chronic kidney disease, cardiometabolic disease, even like Alzheimer's and Parkinson's and, and chronic liver disease. if you see the stats and you see that lonely people have significantly worse outcomes across that whole spectrum, then the question has to be, how do you treat the root cause of loneliness? Well, you have to introduce people to each other and create new friendships. And so, in the early days of group medicine, the first sort of innovators, probably let's say 15 years ago now, they used the efficiency of the group for education, right? So you have a group of 50 people and you give a lecture. It's way more efficient than just doing one-on-one care, times 50 people. But lectures don't create friendships. And so you saw evolution into sort of longitudinal groups. And so in the book, The Community Cure, I talked about, one doctor that was a pioneer in groups that never ended, right? They started off as a diabetes group, but very soon these people had reversed their diabetes because they had now done healthy behaviors and they'd been accountable in the group. And so it became a salsa dancing club or a gardening club because that's what people like to do. They like to be connected every week and they wanted to do healthy behaviors while they were connected because there's sort of like an exponentially increased effect, for that. So that's, where it came from. And so in the book, we looked at dozens of examples of where this new paradigm of health, lifestyle-focused root cause approach, when combined with a group model, was being used effectively and creating great outcomes. You mentioned the Cleveland Clinic Center for Functional Medicine. It's a great story for a number of reasons. One, it's the first academic medical institution that bet on functional medicine in a big way. So big department budget for tracking outcomes. In 2019, they showed that functional medicine delivers better outcomes than conventional medicine, and not just any conventional medicine like Cleveland Clinic conventional medicine. And then in 2021, they released the outcomes showing that group delivered functional medicine better than one-on-one functional medicine and also significantly lower cost. And that's the key part because, I think, if you're listening to this and you think, well, if I had the attention of a doctor and I had, the support of the whole team of care people, I'm not surprised that I'm going to get better outcomes than just someone who's seeing a doctor for 10 minutes every quarter and getting a new drug. So that doesn't surprise me. But what should surprise everyone is that a group delivered model where actually there's no doctor at all. It's actually like a physician's assistant, a health coach, and a dietitian in their model, better outcomes and lower cost. And so that was the moment where I was like, okay, this is, I can see that if it's true that it can be both better outcomes and lower cost, now this could be something that could scale to become a standard of care. And so now I'm in the service of scaling that as a standard of care. And in order to do that, you really have to do it as a technology platform. And I think COVID in a certain way came along at the right time to normalize the use of telemedicine, to normalize the use of technology, to change the billing structures in the US so that this kind of care could be paid for by Medicare and Medicaid and commercial insurance. And so I see a very clear path in the next 10 years to the adoption of group-focused whole person health as really a missing layer that sits between people and the medical system that possibly used to be, delivered by grandma and elders in the tribe, but has been lost through, isolated living, technologification, and all that.
Yeah, the numbers that you explain, I think your book and also the functional forum, you have this slide that's like the factors for chronic disease-related mortality. And then there's kind of inactivity, alcohol's next, smoking, I think, and then I think you call it social stress or loneliness there. And when you see that, it's like the biggest factor just for those that are listening to hit that point home.
Yeah. I was sitting in a lecture in 2015 by a guy who was from the UCLA stress lab, and he showed that data. And I was just like, look, either you drastically transform your practice to accommodate that, or you just aren't really practicing root cause medicine. But ultimately, changing workflows and structures, this is a significant change to the workflow. I was banging my head against the wall for 5 years trying to help doctors say, look, it's clear we have to do this. Let's do this. But it's not easy. It's not easy for an individual clinician or an individual doctor to change the system because it is a pretty dramatic change in the workflow. And so, part of my efforts have been to remove the friction to adoption, right? So that it can become the standard of care. And there's still a long way to go. And there's a long way to go, one, because, it's just the beginning, but also two, because being in a group is not really either aspirational or common enough for people to want it yet. But hopefully we can change that too.
And what have you seen are kind of the key principles in successful groups? I know the health coach is an important role that you talk about.
The first thing is enough time for everyone to get to know each other. So I think you have to have groups that last. And so that's important. I think the health coach is a critical person because by and large, the health coach has enough of a peer energy that they're not like a doctor where they've typically reversed their own chronic condition and are therefore almost like a guide in doing it, as opposed to a doctor who's not trained to be a guide at all. The doctor is trained to be the hero. And in this new paradigm of care, the patient is the hero. So rather than hoping that doctors sort of learn to do it differently, why not just, shift the personnel, because doctors are really important doing, what they're meant to do. So that's where we are, that we think the health coaches are an important part. We have our group staff with health coaches. We've created and innovated in ways to really help people get value from each other, not just from the coach. We have a thing called a progress partner, which is like an accountability buddy, but not as boring. And so, that's what it's taken over the last 3 years to just sort of learn and develop the system.
About the example that you used with Dr. Terry Walls, when she did these group visits, people were actually looking to the person that more recently went through the process. So Terry Walls reversed her multiple sclerosis and is kind of the rock star. But the people in the group, I understood, looked towards the person who would most recently been through the same process. Do you see that often?
Well, that was, again, it was probably like a significant moment for me in my journey. I learned that in 2017. I did an interview with her and she told me that story. And I was like, we're just thinking about it all wrong. If that's true, then how do we take advantage of that? And so, that's, aided my thinking along the way for sure. And I think that's the same in every chronic condition, is that if there's someone down the road that has had the same condition in you and has made even small changes and seen great results, then that person is the person that can most likely get me to shift. And this is actually the reason why, in my opinion, we have not been able to facilitate behavior change at all in healthcare, because in my estimation, I don't think that technology can do it, right? I think that technology can play a part, but ultimately this technology has been around long enough for people to use it and see it. And if MyFitnessPal or other technology really did create scalable behavior change, we would have seen some sort of inkling of it by now. And we don't. Things are getting worse. And so in my estimation, it is a part of the solution. But I really think the piece that's been missing all along is I want to see someone just like me doing it, having success, and then I'll do it. And it's actually the same mentality at the whole health system transformation level. And that's, again, part of the work that I'm doing right now is to create almost like a FOMO between health systems to be like, well, if this group is doing it and they're getting great results, we got to do it because we want to be the leader in this transformation to whole health, or the transformation to lifestyle medicine, or the transformation to functional medicine. And so if these guys have worked out a way to do it in a way that's scalable and profitable, we got to get on that. And so it's really just using, the peer-to-peer human dynamics to facilitate, a real change in mindset. And I think that it's probably, in my estimation, it's the most powerful force, and it's really not being used to its potential.
You mentioned diabetes. If we can, I'd just like to dive a little deeper on some of the programs or the results that you've seen kind of around metabolic diseases. I know you mentioned a case with David Unwin. It's super interesting. What are the kind of major results that you're seeing with metabolic conditions, diabetes specifically?
Well, I think that it's almost like everyone knows now that diabetes is it's possible to be reversed, right? And, that has made its way through society. In the example of like people have written books about it, there are whole technology companies dedicated to it, multiple different ones, and they've had like some success and proof points, in their journey. So I think this is the most obvious one. And look, when I speak to my 9-year-old daughter about the work that I do, and I say, hey, look, if you eat McDonald's every day for 20 years and then you end up with type 2 diabetes, like the way that modern medicine would deal with that would be to give you drugs to modulate your blood sugar, to modulate your insulin sensitivity. In our model, we're just getting them off that, off that food and giving them food that will help to bring it back into regulation. That is so obvious, right, to everyone that is, the way that the only elegant way to bring it back. Like, you don't need to be a rock star, or you don't need to be an intuitive to understand that is like just such a more obvious, elegant solution, right? And my 9-year-old, daughter is just like, clearly, obviously, like, what, how did you even get to a point where the standard of care was all these other things, right? So I think that's clear. So then it's like, okay, well then how do you do it in a scalable way? Technology is proving effective, but the reason why I mentioned David Unwin is because David Unwin is like, with every kind of technology-based solution, you always have a skewing off that it's the sort of more likely to get healthy people that will do it, because that's just the way that it is. If you look at Unwin's data, and this is a general practitioner inside the National Health Service, so this is like inside a normal health service, a normal GP has an understanding that diet can transform outcomes with type 2 diabetes, realizes he can't deliver that knowledge in an efficient way. He starts doing groups, and then over the last 5 years has proved through his data that essentially if you take on this approach, you've got about a 50% chance of reversing your diabetes in his clinic. And that's with no extra money, no extra services, no supplements. It's just showing up, doing his diet recommendation, and being in community. And as a result of that, his costs, specifically his costs of diabetes medication, are about half of all the other clinics around him. And so when someone goes from being diabetic to not being diabetic through this transformation, yes, they're going to use a lot less of diabetes drugs, but they're also going to use a lot less of anxiety and depression drugs and cardiometabolic drugs and chronic kidney disease drugs and everything else, and a lot more other care. So if you were able to look at that from a macro perspective, you would see that the knock-on effects of doing that are really significant. And so that's why I think he's a great example. And I think that I use this example in my presentations because I think it sort of gets rid of all the excuses as to why, well, I know that this other company can reverse type 2 diabetes in these situations, but I'm not like that. Well, this is normal people in a normal GP office inside medicine. And all it took was a doctor to apply the new science of chronic disease reversal through lifestyle and find an efficient enough, consistent enough delivery system that doesn't just rely on the willpower of the patient.
I think this might be a good time as well to ask you about Mexico. I know we spent some time in Mexico. What will our major challenges be when we look at kind of scaling these types of models in Mexico?
The biggest barrier is always like, who's going to pay the bill, right? Because as long as the person who's paying the bill is the end user, you're really always limited to people who, can afford to pay the bill.
Yeah.
And ultimately, sort of paradoxically, the people that probably need it are the people that can't pay the bill. Because how did you end up with type 2 diabetes in the first place? If there's no clean water in your village and all you have to drink is Coca-Cola, because that's one clean source of liquid in your community, then type 2 diabetes is going to be the natural result of that. Obviously, there's a range of empowerment, there's a range of possibilities. But yeah, I think that Mexico definitely has the same problem. It's right on America's doorstep. It's been Americanized to a point where you do have the same factors that affect weight gain, refined sugar, processed food, seed oils, sedentary lifestyle. All of that is the same in Mexico as it is in America. The good news is that America has sort of done that because the problems came to America first. America did a lot of the heavy lifting to work out how to do it, right? So you now have examples in America of technologies, group visits, even the work that you guys are doing at Somos. There are American equivalents that are helping people to really understand what happens to their blood sugar when they eat certain things. So there are examples. I think it can happen more quickly in Mexico. It's certainly needed. But the question will be, and this is why I started Heal Community, is the question will be, how do you get an agreement with whoever's paying the bill? So in Mexico, I think there are possibilities with commercial insurance. So I've got some friends in Mexico that are fired up about what I'm talking about and want to make progress. So I'm saying, you got to start with the people who pay the bill. So I'm like, go and get a meeting with Axel, Bupa, or any of these groups. But the truth is, on the journey to scale, starting with people who can afford it is a good idea. If you look in America, one of my best friends in functional medicine is Robin Berzin. She started Parsley Health. Started out as $150 a month Banner version of primary care, only available in 3 cities. Then it went nationwide with telemedicine. And now if you have Aetna in California, or if you have, I can't remember what the other one is in New York, your insurance will pay for it because they prove that it's valuable, right? You could prove it with one group and then take it to another group. And that's probably the journey that I'd recommend for Somos, is prove that it works, track the outcomes, then take it to some other group where you can get more distribution because you're solving some of their problems. But eventually you want to be contracted with the country of Mexico, and you want to be delivering this to poor rural areas because that's really where the rubber hits the road.
What makes you excited about Mexico? What do you think we have going for us?
Well, I think there is, a culture of community that is probably stronger than America. Like, the sort of community has been destroyed less than in America. So I think there are community structures that can be built upon. And I think, I think that's really strong potential. I also think that Mexico is becoming like a cultural leader in other areas, in art, in cuisine, in music, in technology. So in the last 5 years, I see that like Mexico is really cool and is exporting its energy all over the world in really interesting ways. So I think that Mexico has a lot going for it. I also think Mexico is like well positioned for the next decade. That's what I've come to see from it. And there's a lot of passionate people in Mexico that want to see this kind of change.
And when is Heal Community coming to Mexico?
Look, we've already had some conversations with a major hospital in Monterrey. Ultimately, I'm excited about it. We do have a Spanish language version that we've created. So I think sooner rather than later, I think that Mexico could possibly lead into the rest of Latin America too, because I think, again, it's like we're solving the fundamental issue that is driving all of the issues, which is that if the percentage of people in your country that have chronic disease is going up, and the cost of treating those people, because drug costs more, medicine costs more, the longitudinal care costs more, if all of that is true, the biggest need that governments have is to work out how to stop that. And it's my opinion, based on my own work, that this is the only model that is resource efficient enough to be able to scale in countries that have the kind of demographics that Mexico has. So, we'll see, I guess. But I'm hopeful that in the next decade, we can make meaningful progress to getting everyone into a group and to give them an infrastructure by which they can build real whole health for themselves and their community.
And one thing that I wanted to ask you about, because of what we're building in Somos, is the role of wearables and, tech. I think in your book, you mentioned some wearables are being used for kind of remote monitoring. Are wearables on your radar? How do you think about them? Do they have a role in group medicine?
Yeah, I mean, absolutely. I think we're just at the beginning of that journey. I think there's enough data to suggest that empowering people with their own data can support people to learn about themselves and to make better choices as a way of doing it. Obviously, again, you have to really think through the like distribution and, operationalization of it. And so the best way to learn that is to do it. And you guys are doing it. So I definitely think it has an important role. And I definitely that the same factors are in play with regard to, okay, it's great. If I get this information from my continuous blood sugar monitor and I make different choices as a result, that's really valuable. But if I then communicate what just happened to a group of other people and they all start to make changes based on my experience, there's an exponential effect in that. So I think those two effects together will be part of the overall solution. So I think working out how to operationalize continuous blood sugar handling is a part of the puzzle for sure. And I think will only help in that regard.
You have a quote on your email that says to change something, build a new model that makes the existing model obsolete. So I'd have to ask you about this. If you could kind of wave a wand, or if you were king for the day to make kind of more systemic change happen more quickly for healthcare systems to adopt community group medicine, what would you do? What would be your next moves?
Yeah, well, I think ultimately I would give me kind of what I want right now, which is of enough population to deploy this to, where we could track not just what happens to the patients involved clinically, which we already do. We see incredible results with it. But what's biggest for me right now is getting a big enough population where we can, and actually having enough data to be able to see what are the effects on the patient's use of other services. Like, do people who are in communities, in these virtual communities, do they use the ER less? Do they hospitalize less? And we do have some initial data that is very, very promising on the head. But I think we're going to get to a point where that is just an unmistakable fact, which is that if you're well supported in community, you use the healthcare system less and you use the most expensive parts of the healthcare system less. And I think actually that data is going to be the boulder that starts rolling down the hill, where everyone's like, okay, there's something that does that and we need that, give it to us, and we need to deploy it to everyone as quickly as possible.
And I think we are seeing that slowly happen, James, for the work that you guys are doing. It's often hard to, I guess, quantify that and get all the data.
Well, so I'll just tell you, the first big clinic that we have, that we've, treated a lot of people, they compared the hospitalization rates of the general population in their clinic that didn't have any health coaching, another about equal size cohort of people that had some health coaching, and then an even further group that had been part of a group and had significant health coaching through the group model. And essentially you see a massive reduction in hospitalization, and that hospitalization rate was tracked during COVID. And if you look at functional practices and practices with health coaches, the hospitalization rates were way lower. And that's because the foundations. Now, if you look back at COVID, you see, okay, there are real exciting mechanisms by which, let's say, exercise affects your COVID risk, or your diet and your inflammation levels affect your COVID risk. And so I'm excited to see that we can build on that sort of data and say, okay, it's not just about type 2 diabetes, it's about preparedness, because possibly there's more interest and budget for those kind of numbers.
Awesome. Well, to finish up the episode, we have a lightning round. If you don't mind, there's a few questions. The first question is the easy one. What's your favorite book, or what book do you recommend for people in the space?
Oh, my favorite book, I like Linchpin by Seth Godin. That was one of the books that really encouraged me. And Seth was a big mentor of mine early on to just go out and get it done. And I give Linchpin to everyone that works for me as sort of like an invitation to really own an important part of an organization.
After spending so much time in kind of lifestyle medicine, thinking about that, I'd love to ask you kind of what your daily practices or non-negotiables that you've incorporated into your life to maintain your health.
I have a lot more of a healthy life than I used to. I live in the country, and then I go to CrossFit, and I jump in my ice cold pool in the winter. I live at enough elevation that my pool is basically 40 degrees throughout the winter, and then the summer is 60 degrees. Every night at dinner, I sit around with my wife and my two daughters, and we take a moment to bless the food and bless each other and to connect. And so I think that's probably the healthiest thing that I do.
The next question is, who do you admire in your field that we should probably interview?
Oh man, there's a lot of people that I admire. I would say someone who's having sort of a significant impact, like Mark Hyman, and my world have intertwined significantly. Spoke on the 4th episode of the Functional Forum in 2014, and that was the first time that we got the streaming working. And he announced on that show that the Cleveland Clinic was starting its Center for Functional Medicine, and that was really like a sort of a big moment for my career, because now I've
Super special.
Like, who are these guys and what's the Functional Forum? So Mark's been a great supporter and partner. His impact continues to move forward and grow. But there's some, the thing that I would say is like the person that I respect the most is the doctor or the practitioner that changes the way that they're going to practice and just grinds it out on the front lines every day. The ripple effect of reversing chronic illness in one person affects through a whole community because other people like ask them what happened. So I would say the most inspiring people are really like the people that don't choose the celebrity route, but just choose to be in service to their community, to practice a medicine that is in line with, the way that they see the science, and also the way that they're in love with their job, and they're just doing it every day, and they're not asking for accolades. They're not writing a book. They're not starting a podcast. They're just helping people on the front lines. And those are the people that I have probably the most respect for, because it's not easy, but it's necessary. And the ripple effects are tremendous.
Yeah, that's so beautiful. And the last two questions is, what do you think is an overvalued health topic and an undervalued health topic?
It's a good question. Undervalued, I want to just come back to where we started with loneliness. Look, I really feel like that is such a driver of outcomes. I think that's a critical topic. I would say overvalued, the super intense lab testing that's available in functional medicine that has kind of become popularized. I think it's cool, and I think it's exciting, and I think people get inspired because they want to know like what's really going on. But I really think it's overvalued. I think that, what I chose to do with Heal Community was to focus on the less sexy part of functional medicine, and that is actually activating people into healthy behaviors. And for that purpose, that's what I've been, focused on, is to try and focus on what's most important. And I think in general, people get a lot of information from functional medicine tests and then don't implement, anything off the back of it. So I believe that it's overvalued because it's cool, but it's not really that helpful unless it activates you into a new level of engagement.
Absolutely. It can also be kind of like poking in the dark if you don't get the right response, or if you don't get the right test. So, well, to close out the episode today, is there anything else that we've missed that you'd like to share?
Actually, look, we're going to talk about an overvalued area of health. I would have to say drugs. I mean, ultimately, if in my book, I showcase, if you take away the pharma marketing and you look at real numbers, like what is the number needed to treat, right? For every person that this works for, how many people does this not work for? When you look at those numbers, drugs generally are terrible. And so I would say that in general, the drugs that you're taking could be helpful, but ultimately they're causing other systemic downstream effects. If you find yourself on multiple drugs, those drugs have never been tested in combination, and you're sort of taking your life in your hands by taking those drugs in combination. And so my recommendation to anyone who is on medication is to try and find a way off. And the way off will start with a radical reimagination of who's in charge of your health. And that can happen through a practitioner, but it also can just happen right now. And then the second step is to rebuild function in such a way that you don't need whatever that drug is for. And that's the journey that's for all of us. And I would say, I think it's an overvalued part of health, because ultimately there are short-term effects, there are medium-term effects, there are long-term effects. And if you understand complex systems, of which the body is one, you understand that it's really unlikely that a single molecule is an elegant solution for a functional failure.
That is an incredible answer. Thank you for that. And also in some of those studies, probably the placebo effect isn't taken into account also. And sometimes we don't talk about that enough.
The third episode of the Functional Forum was called Placebo Maximized Medicine, right? How do you maximize the placebo in every patient? And the first thing to do is to honor it, expect it, and to value it. And so I completely agree with you on that.
Well, James, it has been an absolute honor to chat with you. I just want to acknowledge you for the work that you're doing, and on a macro level and also on a micro level. When I was reading Community Care, I actually found myself making changes in my own life. So I just want to thank you for the work that you're doing and appreciate you.
Yeah, look, I wouldn't say this about many other places, but if the government of Mexico called me tomorrow and said, we heard your podcast, we want to do it, we recognize the problems that you have, but you're going to have to move to Mexico City for 3 years to help us implement it, I would do it in a heartbeat. So no to Pablo or whoever else is calling the shots.
Well, we'll be ready and waiting for that. James, thank you so much. Where can we find you?
Yeah, so healcommunity.com is the place for Heal Community. You can follow me on LinkedIn, is when I talk about business stuff. And Instagram, Mr. James Maskell. Yeah. So it's kind of hanging out. And you can get on my email newsletter at goevomed.com. That's really for practitioners. Later this year, we're going to be bringing out the second generation of my first book, The Evolution of Medicine, which is really focused on helping doctors leave the system and start a practice that's in integrity with the way they see medicine. And so that's another part of what we're doing this year, is to try and capture the attention of all the doctors that have quit medicine because of the moral fatigue of being part of something they don't agree with, or just handing out drugs all day and realizing they're not helping people. And, we've helped more than 1,000 doctors sort of take a path towards falling back in love with medicine and practicing in a way that is, in alignment with the latest science and in alignment with empowerment as a foundation. And so you can find out more about that throughout the year.
Yeah, and we'll have to have you on for another episode to hear about all the updates.
Cool. Thank you.
Thanks so much, James.